Today is Fentanyl Awareness Day. According to the CDC, fentanyl makes up over half of all overdose deaths in the U.S. This afternoon, Dr. Stevan Lahr from Family and Children's Services is here with us to discuss what can be done. Thank you so much for being here today.
Yeah, no problem. Thank you.
We've talked a lot about fentanyl, especially within the last couple of years. What makes this drug different?
Sure. So fentanyl is a synthetic opioid, so it means it's not grown. So morphine and heroin are what a lot of people associate with opiates, and those are all come from plants, right? So there's a whole process. Fentanyl is all made in a lab, and so what we're talking about is this fentanyl that's not made by pharmacies, but is made off the street. Fentanyl itself is 50 times stronger than heroin and 100 times stronger than morphine. So that power makes it very deadly. An overdose can be with 2 grams. Okay, so just to visualize that, that's 2 pieces of sand. If that's fentanyl, can kill you.
Oh my goodness. So when you were working with families, you're talking to a client, what should that conversation look like between families when talking to children or maybe talking to a loved one about drugs? What should that look like when talking about fentanyl?
Right, so this is pretty new with fentanyl. Not only is it deadly, but it's cheap to make, and so it's being laced into everything, okay? Cocaine, methamphetamine, it's being marketed as Adderall, sleep pills. It's just been made into pills. And so when you're having that discussion with your family, friends, children, you need to discuss that it's extremely dangerous to take any pill or substance that's not prescribed to you. In the past, there was this kind of belief that the really dangerous drug was like heroin. You had to use a needle, that's how you overdose. But like I said, this medication is stronger than heroin, and so now pills are very dangerous.
And easy to get,
and
too.
Easy to get, sure.
How is it being spread? You touched on this. Sometimes people don't even know what they are taking has it in it. There's just a lot of unknowns when taking.
Exactly. There's lots of unknowns. And so avoiding anything that's not prescribed to you is going to be the #1 way to avoid overdose with fentanyl. And then also having a discussion with family and friends about how do you reverse over. Like if you believe someone may have overdosed on any type of opiate, what do you do? And so that's the whole discussion with Narcan or naloxone. Family and Children's is doing a campaign right now called Narcan Saves Lives. You can go to our website and check that out. We're also installing safety boxes outside of a lot of our facilities where you can just walk up and grab Narcan kits and fentanyl test strips. And so really this is going to become part of kind of like CPR. Like it should be with, yeah, everyone should be educated on how to reverse, how to use the naloxone kit. It's super easy. It's a nasal spray. My suggestion would be if you work or play somewhere that has an AED or a first aid kit, then you should really ask to make sure there's a Narcan kit there too.
Okay, Dr. Stevan Lahr, thank you so much for being here this afternoon.